Hello everyone, welcome to our woodland walk for the tree of the Douglas fir in May. And it's all about connecting to local community. And my guests today, Tom Shutte and Greg Donaldson, are two people who I worked with in the psilocybin for depression trial at Imperial. So we were part of the same little local community of care. And yeah, they've both developed some really interesting ways of working, both in trials. They've worked with 5-MeO, psilocybin, Ibogaine, DMT over the years, so widening their horizons. And they have also both been working in individual psychedelic integration as well. So we're going to hear about their current project, which is looking at the therapeutic modality of psychosynthesis and thinking about how that could be useful for psychedelic integration. So welcome, Tom and Greg. Thank you for coming in.
Thank you.
Thanks, Rose.
Nice to be here.
Yeah, it's lovely to see you both. And yeah, I'm going to ask you both first just a bit about your journey, how you ended up doing this work, and a bit of the twists and turns on your path. So first of all, Tom, hello. Tell us a little bit about who you are and how you got here.
Hi, Rose. Thanks for having us on. Yeah, interesting question. Yeah, how did I get into this work? Really it started in my 20s when I had some completely accidental psilocybin-induced mystical experiences. And I didn't know there were mystical experiences at the time. And in trying to integrate those experiences, I came across psychosynthesis. So it was really psychedelics that got me into psychotherapy and transpersonal psychotherapy. And some of the psychosynthesis writings helped me start to integrate and make sense of those experiences I had. And that took me onto therapy training. And then from there, I started working with clients and started doing psychedelic integration, psychedelic harm reduction work, and then on to working on retreats and more recently clinical trials with Greg and, the kind of much more formal research stuff. So it's a bit of a kind of psychedelics into psychotherapy and back out into psychedelics.
Thank you, Tom. And people listening, some of you may have heard of psychosynthesis, some of you may never have, and we will hear all about what it actually is soon. But yeah, I suppose it's very relevant, the fact that it was the mystical elements of your experience that led you looking for something. And perhaps I'm imagining psychosynthesis was one of the few models in kind of conventional psychology or psychotherapy that really speak to that area of experience. But Greg will tell us more about that. So Greg, tell us a bit about your journey here.
Okay, so well, I suppose how to keep this succinct. Yeah, well, I always feel that I was kind of pulled into the sort of psychedelic arena. I didn't go looking for it really. It was something that I had a lot of experience of taking psychedelics as a very young man and kind of blowing my little brain open and kind of not knowing anything about integration and just sort of diving deep into the world of the different substances. And then sort of during my 30s, I kind of just stopped doing everything. And I come from an acting background. I was an actor. And, so part of my sort of justification of taking all these substances was just like, I like to seek and travel and experience different experiences. But anyway, during my 30s, I thought I better kind of like, learn to stay grounded and, and kind of get a career going and actually focus on being in the world. So I did that, and part of that was kind of coming to out of being an actor and into something that I consider pretty similar to acting is being a therapist. It's a sort of searching why people do things, why they have these motivations, why they are how they are, why people are how they are. And so I ended up at the Psychosynthesis Trust, and just kind of it spoke to me immediately. I just felt like I'd kind of they were using a language that I was, I've been very interested in reading sort of self-help books and philosophy and Eastern philosophy as a young man. And as a kind of psychosynthesis is a kind of psycho-spiritual, modality. which basically includes this kind of Eastern traditions and philosophies, but with a kind of a psychotherapy, a psychotherapeutic model that goes along with that. So I was at this kind of weekend and I had this beautiful resonance with it, and I kind of immediately signed up. Skip forward to, you know, kind of training as a therapist, and then coming back to do a master's at the Trust. This is where I met Tom and a couple of other people on the course, and they were writing their dissertations on psychedelic integration. And I was kind of like, oh, what's this? This is very interesting. Psychedelic integration, I used to, you know, I'm kind of interested in this, but I haven't been around it for a long time. So chatting to Tom and Rebecca Bandera, who was also writing her essay, dissertation on that. And at that point, that's when our mutual friend, Michelle Baker-Jones, got in touch and said, look, Ros Watts is looking for an actor to come and play the part of someone on a psilocybin experience, so that Bill Richards, we can film this experience with Bill Richards showing what he does, you know. And obviously Bill Richards is like the grandfather of psychedelic guiding, and I remember sitting in the kitchen chatting to him, and he was, you know, he'd been talking about how he was a student of Maslow, and he, you know, it's just so exciting to be talking to this guy. And anyway, we filmed this kind of training, and as it was happening, I was thinking, I think you were sort of directing it. I was kind of thinking, this is like a really full-on one-to-one training from this guy, you know. And then from that, I think you invited me to come, and we were going to do some role play at the Imperial training and kind of work out how to, you know, to sort of show someone who's having experience. And then obviously then started working with you on the Imperial trials. And that's why I sort of say, you know, it pulled me in, you know. I wasn't kind of like looking for this thing. And I feel very grateful for that. And also, and I think that's partly why I love working in it as well, because I feel quite grounded in it, because I don't think it's like the only way forward for everyone. You know, I think there's a lot of ways to the same place. But yeah, and then working with Tom on these trials, yeah, which has been fascinating as well.
So nice to remember back to that. And we should talk about psychosynthesis, but I'm also just so interested how, like, your how having that kind of one-to-one with Bill Richards, like, as you say, like an incredibly powerful training, has that impacted upon your practice? Do you think it has affected the way you are as a guide?
Absolutely. I mean, you know, I remember lying on this couch, and kind of, you know, the idea was to be playing someone who was having some sort of nightmarish visions of clowns and sort of different things that were coming up in the psyche. And this beautiful, like, present, loving voice of Bill Richards, you know, saying, "In and through, my boy, in and through," and it was just so loving and present that I think that's the sort of the biggest learning I've taken from it, is like, be yourself and be present, and you know, and hold loving energy towards the participant, the person who's going through this, you know. So for sure, yeah, it's had a big effect.
Yeah, the loving energy you describe, yeah, the resonance of his voice, you can just feel it. It's like a kind of field of, like a magnetic field of, yeah, just safety and warmth. It's, yeah, beautiful.
Yeah.
So you're now both, so tell us about, if you could kind of describe a little bit the basic structure of psychosynthesis, of like what it's saying, and then how you're using it in terms of psychedelic integration, or why you think it's useful for that.
Sure. Well, I mean, I'll give a little bit, and maybe Tom can chip in as well. So, I mean, I've had a really lovely, amazing relationship with psychosynthesis in a way, because, as I said, like when I first experienced psychosynthesis, it was like a very personal opening and resonance with it. And I think, you know, when you train in psychosynthesis, it's a kind of, that's the idea, is that you use the model on yourself. So Roberto Saggioli was an Italian psychiatrist who was like a contemporary of Freud and Jung. He developed this model, and he was, you know, he was born in like the 1880s and he died in 1973. But whereas kind of Freud, you know, loved looking around in the basement and kind of connecting everything to the basement, you know, the sort of unconscious, what Saggioli brought brought to the world really was this kind of idea that actually, you know, there's that we can go up from the basement, we can do that kind of personal work and look at our history and where we come from, but then we can go up and sort of use this model to go up and kind of go out onto the balcony and start looking at the stars and looking at our potential. And you know, this was all sort of around the 1960s, sort of same time as, you know, this human potential movement and Abraham Maslow, and this kind of idea that actually the human soul, the human personality wants to self-realize. There's a kind of teleos, you know, within us that wants to move towards this kind of self-realization. And so he came up with what we kind of call the egg diagram, or it's like oval diagram, and it's a model of the psyche. And you know, we can talk about that more if you want, but there's this sort of idea that there's this model of the psyche, there's sort of these permeated edges to it with the collective unconscious outside, you know, this kind of idea of the Jung brought to the world of like outside in this collective unconscious, there are these archetypal energies and these things that the human race all kind of experience together, not necessarily together, but have a similarity in terms of we might experience these different archetypes throughout our lives. And yeah, and they can kind of permeate into our kind of personal. So in the middle of this egg, there's an eye, and it's like the eye. It's like this, and what the eye is like a reflection, a kind of a reflection of what's at the top of the egg, and all around the egg is this kind of self, this higher self, a self with a big S. Other kind of theorists have put the self in the egg as in like a big S within it, because it's, I think there was a bit of a problem with this idea of like hierarchy, like moving up from the bottom to the top. Oh, and then you're like, you go up and up and up, and then you're kind of self-realized. And actually, what's really lovely about this model is like the self can be realized, the self can find openings anywhere within this model, you know. When you're in your darkest depression or your lowest point, maybe that's when the soul breaks through and speaks to you. Or when you're kind of in meditation or having some sort of psychedelic experience, maybe the same thing, you know. So it's not confined to this kind of hierarchical model. But anyway, so anyway, what that it sort of tries to show in this, I mean, all these kind of maps are kind of limited in some ways, you know what I mean? But it's a way to kind of get it down, is that actually within this egg is a kind of a lower unconscious where our sort of darkest animalistic or past traumas may reside, and we keep them unconscious. And then in this top higher unconscious is like this sort of potential in us, like these things that we also might keep unconscious, like our creativity or our way to express love, or you know, just, you know, as a child you may have been taught like, don't, you know, stop, can you stop singing, it's really annoying, don't sing, you know. And so we push that up into our higher unconscious and go, oh yeah, singing is not a thing that I do. And you know, and then in this middle bit of the egg is like this kind of eye, and this sort of middle awareness of the things that we know about ourselves, things we are aware of. And really part of what psychosynthesis invites us to do is like expand this sort of self-awareness, and to travel around this egg a little bit and kind of start exploring ourselves and start exploring, you know, I suppose the simplest way to put it is that we are a soul. We're a soul incarnated into this earthly realm, and with this kind of funny meat suit, you know, that has a kind of personality. And through whatever, you know, growing up and living in the world, this personality develops its own sort of survival structure. And psychosynthesis really invites us to kind of remember that we are soul, we are, you know, and that to connect between the personality and the soul can like shine through and affect the personality. And that's the kind of synthesis in a way. So we learn to mature. So yeah, have I kind of given that does that make sense? Maybe Tom wants to maybe you want to add some more to that.
Very, very little to add. Quite inspirational listening to you, Greg. Yeah, I mean, I think for me as a practitioner, what psychosynthesis gives me in terms of working with psychedelic integration and kind of altered states and stuff is it's a lens, you know, a lens like and quite a broad, inclusive lens that includes transpersonal experiences. And when you're training, you do a lot of active imagination and different exercises that do put one in a kind of altered state. So you get quite used to working with, yeah, images and subpersonalities, you know, what IFS would talk about parts, and psychosynthesis would talk about subpersonalities. And I guess it's a framework, it's a lens that allows you to work with the sort of transpersonal, unusual, mystical, archetypal experiences that people do have. So yeah, it kind of fits quite well. It's just a framework, it's just a lens, it's not the truth, it's not the answer to everything, it's just a perspective. But yeah, it fits quite well. And I think for some other practitioners or for some other modalities, some of the sorts of experiences people can have on psychedelics don't fit very easily into their models, or can, yeah, or perhaps just fall completely outside of them. So yeah.
Interesting. So if I've kind of understood it right, that the whole idea of kind of expanding the central section of like what we include in ourselves, that something like a psychedelic experience, which can take you very low or very high, is taking you to kind of the edges for you to bring those parts in, and that the model itself can hold all of that, and that it feels like quite a kind of creative and interesting way of working in that, because it's the kind of the language of the soul rather than I suppose psychology is the study of the soul in a way, but it's also, yeah, the mind, the soul. This feels like it's more kind of multimedia in a way, like multicolor, like it brings more artistic, creative. Is that a fair assumption? Or yeah, how is it different from kind of other models of the self?
Yeah, I mean, I think I would agree with the way that, yeah, what you've heard. It's basically, it includes the transpersonal or the other, whatever you want to call that. And I think Assagioli himself, you know, sort of said, you know, we take you to the edge of what that is, and then it's up to you to decide, really. It's like, because, I mean, that is ineffable, really, isn't it? It's like, how do you describe what that is, that other thing? That, I mean, I suppose I'm just using the word soul because that's what resonates for me the most, you know. In the egg, it would be called like the self or whatever, but I find that confusing, slightly confusing, because it would be like the self with a big S, and then the small self, and then you know, it's so that's what's also so beautiful about the model itself, and about the way that Assagioli kind of has given it over, because he sort of said, you know, this is the beginning, like, and so many bits of psychosynthesis have evolved over the years, you know, since his death, from other theorists kind of working with it and adding things to it, you know, and that's what's beautiful about it, really, for me, that it's like a dynamic, it's a dynamic, and you can add to it, you know, and that sort of permeation that I was talking about, like around the edge of the egg, you know, like I love the last time that we presented this workshop that Tom and I presented at the Psychosynthesis Trust. You know, we were discussing that idea of like the permeations on a psychedelic experience almost become sort of less. So there's like more content can kind of flow in and out. And there's also these sort of permeations between the higher unconscious and the lower unconscious, these permeated lines that also can open up. And, you know, obviously can be quite confusing, because it in a kind of medical model sense, you might consider that to be a spiritual emergency or a psychosis, you know. So it's but looking at it through a psychedelic lens, I guess, it's like, yeah, if you're held in the right way and that you can trust and let that, whatever comes through with that, then the models can be really useful.
And so if somebody went to see a kind of mainstream psychosynthesis practitioner or therapist who didn't have specialist psychedelic experience or knowledge, and somebody went to them with a psychedelic experience, would that be something that a psychosynthesis kind of therapist would be very comfortable with incorporating into your treatment model, just because it's kind of makes sense in the model? Do psychosynthesis therapists, are they kind of literate around dreams and psychedelic experiences usually?
Do you want to take this one, Tom? Or
Yeah, I mean, I would hope so. You know, I can't talk for everyone. I think that yeah, I mean, you know, a lot of psychedelic experiences often about images, you know, and yeah, psychosynthesis, you spend a lot of time working with images, looking at the symbolic meaning. I mean, in my journey, that was often through dreams or you know, guided imagery or visualizations and things. So it's not just about images from psychedelic experiences, but yeah, I think yeah, I mean, the answer is they should be able to, and often are. And I think Jungians are also often very good with that, you know. So some of the research that I did around the integration of ayahuasca experiences was looking at, you know, people that have had experiences and have gone to different therapists. And it tended to be the Jungians that were most useful and the psychosynthesis therapists that were most useful with ayahuasca experiences, because there's often rich imagery or symbolism or parts, or, you know, there's an image that needs to be decoded and thought about. And I think that often people get into trouble with psychedelic experiences if they don't have an experience of meaning making from symbols or thinking symbolically, and they get confronted with an image and they take it literally, you know. So yeah, that's quite a long way of saying yes.
That's really helpful, is particularly the focus on the image. I think that really helps me understand how this would be really helpful as an integration model. And so could you tell us just a little bit about what you're doing together, how you're kind of bringing this in, and how we have lots of therapists in the ASA community. If people are interested in this, how can they learn more? How can they develop their skills in this? It sounds like a really good kind of string to add to your bow as a psychedelic therapist. Although maybe it's a very lengthy training, so maybe a very big string to.
yeah, well, I mean, I think that's kind of part of the, you know, we're doing like a 1-day training. It's kind of like you can consider it a CPD training at the Psychosynthesis Trust in June. But also I've kind of set up a kind of a psychedelic CPD events company that will be, you know, including psychosynthesis, but also looking at other models of integration as well. But yeah, I think if you're already a therapist, then you know, there's something about knowing that you know, models go as far as they can go. Do you know what I mean? And then and ultimately, it's kind of more about presence and the relational aspect. And yet, because of, like Tom says, like psychosynthesis will include this kind of trusting dreams or trusting images, you know, doing visualizations. I remember when we were doing the Imperial trial, actually, there was a meditation that you came up with, Ros, that was about the pearl diving, and that was part of the preparation. You know, and that's kind of very psychosynthesis in a way. It's like, well, I mean, you could call it psychosynthesis or whatever, but it's that imaginal realm that that is accepted within this kind of psychosynthesis frame, and so, you know, seen as a sort of beautiful route in, and to trust that, you know, whatever, even if you don't understand it at the time, this is an image that came up, you know, and this is an image that, you know, often when I'm working with clients, actually, just giving presence to a client, you know, if I'm not sitting there worrying about what's going on in my life and all the things that are happening, you know, I'm kind of radiating my own presence towards the client. I noticed that I get images of things that come up and come through, and I've got, you know, I love to share those images with the client, even if they actually don't mean anything. Most of the time they kind of do. They kind of say, oh God, yeah, I could see why that, yeah, there's something in my life that's going on. And I suppose that's, again, it's like, something about intuition, developing intuition as a therapist, and trusting that. And psychosynthesis, I guess for me, encourages that. And so if you're a therapist already, and adding a little bit of psychosynthesis sprinkle on top, I imagine would be quite helpful.
Yes, and I love the idea of CPD, psychedelic CPD. That's a really brilliant idea, I think. I'm imagining they're all going to be in person. Are they in the UK, or will they ever be online as well?
Yeah, I think it'll be a little bit of both. It's a bit of a work in progress at the moment. Sort of this idea of the original idea was actually to like set up some really beautiful, really beautiful events, like maybe one-day events that are very psychedelically informed, in terms of like, we won't be sitting in a kind of like fluorescently lit, sort of dry kind of like plastic cup, of coffee, and kind of getting your CPD, and just, it's like sort of these beautiful events in beautiful places where in the lunchtime you can go and do like a Tai Chi thing, or there might be some, nice entertainment, nourishing food, and just very holistic events, well, both of you would hopefully be talking at, and sharing your wisdom, and some other great practitioners that are in the community, So yeah, look out for that. psychedelicCPDevents.com.
Yeah, great. No, it's great to plug it. It's a brilliant initiative. And give us the date for your psychosynthesis day, that you're both hosting this together. You're both delivering that together. When is that?
It's the 14th of June.
14th of June.
And it's going to be in London Bridge.
In London Bridge. Okay, cool. Well, it's been really lovely to see you both again. And I'm really inspired actually by this, because it makes me realize that a lot of what we're doing in ASA actually feels like it has that kind of, we're often spending time in these imaginal realms and going into the kind of the visualizations or the embodiment of working with trees, going to this kind of forest of kind of, yeah, symbols and images and memories and feelings. And it's a kind of imaginal realm that we've created. It's this forest where we kind of go to feel and to learn. And it feels like that is this whole idea of going to those kind of those edges of our experience to pull in the bits of our soul, like the bits that have resonance. So I don't know if that shows that I don't know if that's me understanding the model well, or me misunderstanding the model completely, but either way, I love that as an idea of like pulling in, going to the imaginal places to find the bits of ourselves that we've kind of like, almost like breadcrumbs of the self that we've kind of left in places, and we're going to find them.
That's beautiful. Yeah, that's yeah, that resonates. And ASA definitely gets a mention in our training, because it's kind of a big, well, as you say, it's like a cross-pollination in a way, isn't it? It's sort of like, let's share integration ideas and ways to work. So that's in there, yeah, for sure.
Oh, well, we're creating a little imaginal, dreamlike integration ecosystem together. I think psychosynthesis will really add something really, really powerful. So thank you both for doing it. And you're both going to be at our Q&A on the 21st of May, 7:30 to 8:30 p.m. UK time. And people can come and ask you about, so you've worked in the clinical trials with people with all sorts of different presentations, which I know our community will be interested in, like alcohol use disorder, depression, PTSD, and with, as I said before, 5-MeO, psilocybin, Ibogaine, and DMT, which is a huge range between you of really interesting trial work. And then, of course, everything we've talked about today with your psychosynthesis work. And yeah, people can ask you questions. And I'm going to be asking you a question, Tom, when we have our Q&A about, now I know more about psychosynthesis, and you said at the beginning about your own journey. I'm going to be asking you about your own psychedelic experience, and what images or what kind of resonance the psychosynthesis helped you, like how that helped you on your path. So telling you now, inspiration.
I'll do some reflecting. Looking forward to that.
Yeah, I'm really looking forward too. So yeah, thank you so much, both of you, and see you next week.
Thank you, Ros.
Thank you, Ros.